February is American Heart Month and a time for people to really focus on their heart health. Tomorrow is National Wear Red Day. Heart disease is the leading cause of death for women and men in the United States. And according to the CDC, nearly half of adults in the U.S., that's more than 121 million people, have some type of cardiovascular disease. Heart disease is also preventable 80% of the time. To talk more about heart health is Dr. Roxana Mehran, an interventional cardiologist and director of Women's Heart and Vascular Center at Mount Sinai Hospital. Thank you so much for being here.
Thank you so much for having me.
Now, who is most at risk for heart disease?
Well, women, and I'm going to talk about women today, are at high risk. Those who have risk factors, the known traditional risk factors: hypertension, diabetes, obesity, sedentary lifestyle. But we also have to think about, and diabetes, did I say that?
Yes,
oh, yeah, very important. And very important for us is also to think about the communities where we know there is highly affected, there's a high prevalence of heart disease, and those are in the communities of color: Hispanics, blacks, Native Americans. And a lot of communities where there's a lot of undue stress and, of course, low socioeconomic status.
And that's so interesting about the stress. One of the biggest contributors to heart disease is stress, as you say, and mental health, which I had not heard before. How are they connected?
Yeah, you know, it's really a very new hot topic in research. We're doing a lot of this work through the Lancet Commission. We have really focused a lot on mental health. It's an under-recognized risk factor because when there is stress and anxiety and poor mental health, you start having higher blood pressure, higher heart rate, because of the hormones that get stimulated by stress and anxiety, like adrenaline and cortisol. And then there's also a linkage with inflammation, and we absolutely know that inflammation is associated with cardiovascular events.
So how can we avoid heart disease?
Well, eat well.
Yeah.
Know your risk factors. You need to be educated as a patient. You should know what your numbers are, and you should be educated on that. And then, very importantly, is, of course, avoiding sugary drinks, getting rid of the fad diets and salty foods and canned foods, eating fresh vegetables and fruits, and then very importantly is caring for your stress, anxiety, your mental health. I do believe you need to have a circle of friends, a place to go to think about that, and to be able to share what's going on with your mental health.
That's so important here at CBS 2. We're really big into breaking the stigma of talking about mental health, so I'm so glad you're talking about it. Let's talk about the Heart Health Fair at Mount Sinai tomorrow.
Well, very excited about it. In collaboration with and partnership with the American Heart Association and recognizing Go Red for Women, in all of our communities across our healthcare system from 11 to 2 tomorrow, February 3rd. There'll be in Queens, Long Island, as well as Brooklyn and multiple places in Manhattan, there will be a heart health fair. There'll be blood pressure screening, cholesterol screening, lots of educational programs, and I think it's going to be a great way to think about taking charge of your heart health. We care about your heart health.
What are some of the symptoms that people should know about? I know they're different in men and women.
Very important. Women, it's as if they didn't read the textbook. Like what we learn in medical school is about, you know, substernal chest pain, pain right over your chest, and sweaty, and, you know, and short of breath. Women could have just very non-specific and unusual symptoms. So listen to your body as a woman. When you know you have the risk factors, if you're not feeling right, call your doctor. Make sure you get checked out.
We talked about this. I'm going to come to you. I want to get checked out because this is so important.
It would be my honor to see you.
Doctor, thank you very much.
Thank you for having me.